today would want to educate us on so that we do not make certain mistakes as we go on. Let me also indicate that breast cancer happens to be a significant health challenge that the world is confronted with. It was alarming when I read that in 2022, about 2.3 million new cases were recorded, and that's very alarming. Again, among all cancers, I'm sure Professor Mona would either say it is right or wrong when he has the microphone. I hear it is the mother of all cancers. And since the 1980s, I read, there have been some efforts made, to catch the disease early and then get people treated so that they can survive it. And so there have been some strides made in survival rates. But then again, it has been attributed to the fact that certain countries are running programs where they are able to detect and catch the cancers early to help individuals survive. So this afternoon, we are gathered here to talk about the breast. And this is by the kind courtesy of the Breast Society of Ghana. We are commemorating the 13th Oguaa Breast Cancer Awareness Durbar, which is themed Breast Cancer, Stop the Stigma and Be Supportive. Kindly note that this is the Grand Durbar and the Empowerment Project. My name is Akosia Achiabiasaki, and I'm pleased to be your MC. I would ask you to help me welcome Mrs. Linda Obeng Ansong to do us the honors with the introduction of the chairperson for this gathering. Let's welcome her.
Good afternoon to everyone. It's my singular honor to introduce the chairperson for today's program. The chairperson is an associate professor of entomology. She holds a PhD in zoology from the University of Cape Coast and pursued postdoctoral studies in geometric morphometrics and molecular systematics at the University of Sao Paulo, Brazil. A 2001 Fulbright scholar to the USA and a 2013 Brazil CNPq TWAS research fellow. She has established herself as one of the most distinguished scholars in her field. Her professional contributions are extensive. She serves as the Deputy Director of the International Stingless Bee Center and the Resident Bee Taxonomist for West Africa. She is also a 2024 recipient of the Female International Ratu Meli Apiba Award for Eminent Stingless Bee Scientists and has been recognized as the Distinguished Pro-Stingless Bee Director from Ghana. Beyond these honors, her network span the Center for Gender Research, Advocacy and Documentation at UCC, the Entomological Society of America, the British Ecological Society, Graduate Women International, the African Pollinators Initiative, and the Ghana Science Association. Her work has led global impact, particularly through biodiversity assessment projects such as the FAO Global Pollination Project, the Stingless Bee Project in Ghana, and the National Science Foundation's Ordinator Project. With more than 20 years of experience as senior insect taxonomist and curator at the Entomologist Museum of UCC, she has not only contributed to advancing science, but also mentored and supported countless students and served as a consultant on youth and women's alternative livelihood ventures. The chairperson is an inspirational leader, a value-driven team player, a dedicated advocate for innovation, youth development, and gender empowerment. Currently, she is the provost of the College of Agriculture and Natural Sciences at the University of Cape Coast. Please, with a round of applause, kindly join me in welcoming our chairperson, Professor Rofila Kombi.
Good afternoon. Thank you, Mrs. Linda Shaw. I have seen colleague professors here. My sister is joining in now. Professor Georgina, welcome. So, I want to acknowledge all my teaching faculties. Our administrative staffs are here. I have seen teachers from different schools. I have also seen many institutions around our campuses. Our favorite media personnel are here, and as well as our sponsors. I want to greet a good afternoon again. Ladies and gentlemen, this afternoon, it is an honor for me to be here, but I am with mixed feeling because it strikes home to me. In 2016, I became a caregiver to a teenager who has just been diagnosed with ALS. For me, the funding wasn't the issue. The pain of seeing him waste away wasn't the issue. The numerous travels in and out of all the hospitals wasn't a problem. I wasn't burdened by the weight on my career, but the pain was the insinuations, the bickering, the hate speeches, all the kinds of lies people do it. Love was far from us. Between 2016 to 2018, I watched him waste away. Irrespective of all the interventions. You see, in this case, he was just diagnosed with high fevers, malaria, high fevers. That was consistently the treatment that he was receiving until I said no. I changed hospitals. I went to different healthcares and experts. And then finally, the final diagnosis was given. He was at the final stage. We can only manage the case. Today, we are gathering under the theme, Stop the Stigmatization. The pain may be strong, but love makes it bearable. I came out from that particular experience making a statement that the day we become human, the world will be a better place. It's the first time I've talked about this publicly. The pain is real, but love and support makes it bearable. So I am happy to be associated with this program, and I respectfully and humbly accept to chair this meeting. Thank you.
Thank you very much. We could do it better. Let's applaud our chair for accepting to be here. And Prof. Chair, one thing that we usually take for granted is the fact that this particular cancer is no respect of sex. You just mentioned that your experience was with a male, and so each and every one of us here should be concerned. At this point, I mentioned that this is the Grand Durbar, the Empowerment Project, and to help us with an understanding of this is Professor Akwesi Anyamfo. Let's welcome him with a round of applause.
Thank you very much, Grace, and thank you all for coming today. The Empowerment Project, it's in 5 regions: Greater Accra, Central, Ashanti region, Volta region, and Northern region. So this is the second of the series. We finished the Greater Accra one. And I remember one of the chiefs who came said, today we are talking about breast. And then so I always have a friend who was called Nufusin. So we used to tease her that her name is Breastina Na Fofo Nufusin. Yeah. So today we are talking about Nufusin, and I will start with the empowerment project, the project that sponsored this gathering. Shall I have the first slide, please? Next slide. So that's the study, and that's my name. We scientists, we don't talk too much, so it will be a very short presentation. So, just as the MC said, 2.3 million cases were diagnosed in 2022, and out of that, over 655 died. So you can see that's about 34% of women diagnosed die every year. Next slide, please. So we come to our country, Ghana. We annually diagnose about 5,000 cases, and then half of them die. So in the world, whilst 34% die, which is bad enough, in Africa, sub-Saharan Africa, 50% of the women who are diagnosed die from breast cancer. So it means we have a higher number of women dying for breast cancer. In reality, there are more whites diagnosed with breast cancer than blacks, but more blacks die than whites. I'm sure Professor Mona will talk about it. Next slide. So, like she said, breast cancer cases will increase. In fact, cancer cases in the world would increase. As we live older, cancer cases increase. But in Ghana, we are helping the cancer cases increase with Galamsey. So even though it's increased, we want to speed it up. So that's why we all should talk about Galamsey. So because it will increase, how do we prepare for it? So how do we better detect it in order to increase survival? And then, if we are able to increase survival, how can we offer guidance to our ladies who have survived? And then, how can we embrace them into the society? Next slide, please. So that was the aim of BSOC, that's Breast Society of Ghana. It was formed in 2018, and it was to carry out anything breast cancer related. So breast cancer advocacy, and then provide support for those who are diagnosed with breast cancer, and then seek funding. So one of the funding is what we are seeing now. We sought funding from Pfizer, and they are sponsoring this. And then lastly, influence policy, right? Especially NHIS and the rest. How can we influence them on this? So once Breast Society was formed, in seeking money, we went to Pfizer, and Pfizer gave us money for the empowerment study. So empowerment is what you can see, enhancing management of breast cancer. So the letters that are highlighted all make up empowerment. So this is what empowerment is. So that was the aim. Next slide, please. So the goal was to establish a support system and then engage the community. So they need support, and then also need a committee to accept them. So establish a support system and engage the community through education, because lack of education is what brings most of the problems for patients diagnosed with breast cancer. And the objectives was to assess knowledge on breast cancer, and then find out how much people know about breast cancer, how much the community know about breast cancer. And then in places where there are cultural aspects, cultural relationship with breast cancer, because in some communities, if you have breast cancer, you can't even buy at the market. So assess how the community deal with these breast cancer patients, and then produce a manual which will be culturally sensitive, so that patients diagnosed would be accepted. And then afterwards, we want to train and equip navigators. They will now, we can't be everywhere at the same time, but wherever we go, we train navigators so that when the project ends, these navigators can now carry out the work. And then we want to assess the overall implications of how breast cancer is affecting Ghanaians in general. So why do we need to do all this? Maybe the next set of slides are not so good, but you have to show you what cancer can do to women. So next slide. Go back. Back. So this is a lady, 42 years old, who had breast cancer. You can see with the blue arrow that there is some small pore on the breast. So over here, I saying that size does not matter. Size of breast does not matter. And the cancer, even a small size, can kill you. Unfortunately, this woman passed on. Next slide. So why would you wait for this to happen to you? I'm sure Dr. Mana will highlight it. Why wait? What were you waiting for? Why did you come early? Why did you come early? So more pictures, and then, like we said, breast cancer can also affect men, not only women. So this man is a champion of breast cancer. He got breast cancer and survived. What happens is when men get breast cancer, we die faster. Because for women, the cancer can stay in the breast for some time before it moves into the body. But because we don't have breast, once it affects that, it's going to the body. And Dr. Mana will highlight more on that. So this man is a champion of breast cancer. So back slide. I wonder why the slides are moving. Yeah, next slide now. So that's why we are here today, to talk about breast cancer. And then tomorrow we would also walk from Studio Park to Victoria Park to create breast cancer awareness. So I'm hoping to see you all there. And then there's one lady who was diagnosed with breast cancer at the age of 19, and then it was so aggressive that they had to cut off both breasts. So every year she used to walk the whole of October in the US to create awareness for breast cancer. This was some years ago. Now she's done reconstructive surgery, and then now she has artificial breast. But breast cancer is a respect of no persons. She was 19 when she was diagnosed and had to have both breasts cut off. Next slide. So as my Nigerian friend will say, you these Ghanaians, you always like talk shop, talk. Everything is talk. You don't act. So I'm now challenging us all. Let's stop the talk shop and do the workshop. Let's now be active advocates for cancer. And then let's stop the stigmatization. The survivors need our laugh and hugs. You hear a survivor tell a tale, and then you realize what they go through. So always remember, everything with cancer, early detection saves life. And it's a joint action for breast cancer. We all are involved, and we all can work together to succeed. I think that's the end of my slides. So let's all come here next year and tell a very good and different story. Thank you very much.
Thank you very much, Professor Yamfo. Let's do it for him again. I love the fact that when he was speaking, the reaction, a few verbal listenings I was hearing, and all that. I hope that we're going to pay attention to the next session, because he's going to actually speak to us on what breast cancer is, understanding breast cancer, I believe, causes and all that. With a warm round of applause, let's welcome Professor Martin Mona.
Good evening to you all. Yeah, and Madam Chairperson and my fellow colleagues here, fellow students. I was just telling the lady sitting by me how eons ago we matched ourselves here to the university to listen to a program when I saw the students. I'm a Santa Clausian. So we have to iron the shirt very well. The trouser has to be very well. And sometimes the juniors may not have their shoe for one day because you don't have a nice shoe. You say, Charlie, put that shoe down. You can't use some. So it's nice to see all of you. I'm trying to, when I was giving the topic, I decided that it's more important for me to educate here than to try to impress people by talking about complicated terms and things like that. If you leave without understanding what I've said, and then I say a lot of complicated medical terms, then I've achieved nothing. I'm an educator, and that means a lot to me. So let's go. The slides. Oh, there. Yeah, sorry. Thank you. The first one. So, what I decided to do was to just ask questions and try and answer them. What is cancer? Or what is a cancer? How does one develop a breast cancer? No, don't change it quickly. How does one develop a breast cancer? What are the risk factors of developing a breast cancer? How do we diagnose it? And then what is sequence? When you're going to make a diagnosis, how do you do it? And what is the, how big is the problem? I think that part has been answered. So when I get to that slide, I'm just going to jump because we all know that it's a big problem already. Now, what is special about talking to citizens and people here in Ghana is the fact that we shouldn't behave as if we are the same as those in the global north. The average age of people of a lady developing breast cancer in Ghana is very, very low, whereas it is about 65 years elsewhere. Here it's about 45 to 35 years. I just took care of one this afternoon. I saw her while she was in school, and I operated on her. She came back with another nodule. I did the operation again, and it tells you that the disease doesn't really go away. But now, and I'll tell you why. So, what's a cancer? You know, all of us are walking miracles here. Everybody is a walking miracle, because if you take each cell, the cell goes through a cycle. It gets formed, it may divide, or may not divide. And after some time, it's supposed to go through a process of dying away. We call it apoptosis. And then its place gets replaced by some other cell. Cancer cells don't behave like that. They don't die. Okay, they just have this capacity to keep growing and growing and growing. They replicate themselves without ever dying. And that is what makes them so problematic. They grow without any signal. Most times, growth of a cell needs certain signals for it to start to grow. In the case of a cancer cell, there's no need for a signal. They don't die. And what makes them bad is the fact that they have the ability to invade normal tissue and take up the normal tissue. Okay, so if it even grows in one place and doesn't invade, you could go there and excise it, but it would grow into bone. And for the case of breast cancer, it would go into your bone, into the brain, into the liver, into the lungs. Any of those places are possible places where the cancer cells can get to. And that cell that gets to that particular organ competes with all the other cells there. So it just keeps on invading, and then at some stage causes the organ to fail. Next slide. How does one develop a breast cancer? You know, the breast is a skin appendage. It's just part of the skin. And that is why operating breasts don't normally cause a lot of trouble to the doctors, and the post-operative problems are very, very little because you are dealing with just the skin. People get scared of getting operated when they have a breast problem. But I've never seen someone go to the theater, have a breast surgery done, and then had gotten into shock and died. No, it's a very easy procedure to undertake. So the breast itself has got its main function, and that is to produce milk. And the part that produces the milk are called lobules. And then the tracts that brings the milk to the nipple are called the ducts. And these lobules and ducts are lined by cells that are always working. They are always replicating. They are always changing. They are under stress all the time. Every woman produces estrogen. And the estrogen keeps on stimulating these cells, and they go through a series of activities that involves accidents within the cell. When the accident occurs in the cell and it is not repaired, then that cell becomes mutated. And the mutation is what causes it to develop this capacity to grow without dying. Within each cell are certain genes that can suppress the tendency for one to develop this mutation. Or if there is a problem with the chromosome, okay, any problem within the cell nucleus with the chromosome, there are genes that helps the repair to occur. Now, anytime those genes also become incapable of doing their jobs or suppressing this mutation, then it's likely to occur. So, in actual fact, the cancer occurs as an accident. Some people have a tendency to get that accident and others don't. We all drive to Accra, some people get there and some people don't. If you take a vehicle, you buy the vehicle new, the chances that the engine will have a problem is less than as the person grows. So it's no wonder that as you grow older, there's a chance of one of such cells, and there are millions of them. Any of them can get into trouble. That is why I say that we are walking miracles. So after the mutation, these cells just keep on dividing and wouldn't stop dividing. So, but there are certain triggers. The triggers may come from the environment. You heard Professor Yamfo saying that galamsey is going to cause problems for us. Yes, it is true. Arsenic, the lead, the mercury, and things like that. They stay in there, you eat it, it gets into your body, it doesn't go anywhere. Then it gets into your cell, and then it causes the accidents to occur. And sometimes the tumor suppressors are inactivated because of it. So when a patient asks me, so how did I develop this cancer? What is a cancer at all? It's so difficult to give a straightforward answer because it's complicated. And it's full of a lot of guesses. It may be this, it may be that, it may be that. Sometimes some of these triggers are lifestyles. If you have someone who drinks a lot, the alcohol could be the cause of it. If you smoke, the smoking could be the cause of it. If you're someone who eats without discretion just because you have the money to buy the food, if you put on a lot of weight, the more you produce estrogen peripherally, which also keeps on stimulating the breast, and then the mutation may occur. Now, you don't need 3 cells, 100 cells to mutate. One rogue cell, and then it just keeps going. Next slide, please. What makes it bad is that a breast is something that you can see, you can feel. It's not hidden. We men have our big problem, the prostate, so far away and hidden, and so difficult to evaluate. And yet the breast is competing very well with prostate in terms of the numbers of cancers that we have in it. So it makes this gathering very important because it is the fact that we know that we can evaluate and get to it earlier without trouble. That makes it important for us to educate. Okay, so we have to keep pushing on this. It's just a skin appendage. The thing is that it has no clinical manifestations that will make you know that I'm beginning to get a cancer. Most people who come to my practice for consultation come because they have a chest pain, a breast pain, and then they think that it's a sign of a cancer coming. Now, it's the other way around. A safe breast, a painful breast is safe. The painless lump is the one that is the problem. Okay? So anyone who goes beyond 40 years who finds a lump that is like even a peanut, you have no business taking a decision on it. The average doctor, and I'll say average doctor because we don't all do the same thing. There are things I can do that the cardiologist cannot do or the general practitioner cannot do. And there are things that they can do that I can't do. But if you go to anybody who doesn't think about it every time, he's going to tell you, go and take amoxicillin, go and take that, and then just waste your time. I would see something and say, whoa, stop. Let's see this. And then someone else will say, oh, it's not painful. It's okay, just go and take antibiotics. It's not his fault. So it's very important. The symptoms of breast cancer are actually evidence of advanced cancer. If you are you are talking about symptoms, there are no symptoms and signs. Maybe an early sign could be just bleeding from the nipple, or you see blood come out of the nipple without you making any effort to even press at it. White breast discharge is normal. Straw-colored discharge is normal. But bloody discharge is dangerous. And blackish discharge is dangerous. It means go for evaluation. Most of the chest pains, the pain that is in the breast actually comes from a chest wall. It has nothing to do with the breast because the breast shares nerve supply with the rib cage. Okay, so you can have pain, we call it costochondritis. If you have that, it may give you pain in the breast, and most of the time doesn't mean much. But certain very advanced breast cancers can cause pain. But most of the time, those ones are so obvious. They are obviously cancerous. You can see that this is a neoplasm. Next one, please. So let me see the picture, please. The picture. So if we take that, the first duct over there, that's the duct through which the milk passes. And everything I'm saying applies to men too, except that we don't have a lot of these lobules and ducts in us, so the chances that we'll get into trouble is less. That's why women are 1,000 times more likely to develop the disease than we do. Now, oh Lord, it looks like a traffic regulator. Now, we call it travigator, right? It's not travigator, please. It's traffic regulator. How about traffic? Yeah. So, you see that all those cells there, they get produced from the base and get replaced when they die off. So, if one of those cells become malignant, then they keep on replicating. And instead of invading straight away, they first replicate inward and then occupy the lumen. At that stage, the cancer cannot move anywhere. It is controlled by the basement membrane. But when it gets to the point where it breaks across the ducts and gets into the lymphatics, these whitish parts are lymphatic vessels, then once it happens that way, whatever we do for the patient is just palliative. The patient would be angry with you. I did this operation that took all this and look at it, it's coming back again. It's because we were palliating. Probably it would have been worse if you hadn't done anything now. 10 years on, something happens, when we get there, we deal with it. Okay, so that's basically what happens. That is why when the disease starts, you can't feel anything. If you are waiting to feel a lump before you go to the hospital, you are late. So what do? It's not anyone's fault. If it's small, it's still better than it being big. So I'm not saying that if you see a small one, you should feel guilty. So self-breast examination is important. But I'm urging all of you, you have the doctors that you go to. Everyone has someone they like. And you should prompt the doctor that you need to have your mammogram done. Because we do not have a screening process in Ghana. Okay? So if you don't prompt, they may not do it. I tend to try to do that for all my patients. This month, everyone who comes, I will tell you, when is the last time you did it? If you are average risk, you do it once every 2 years. If you are high risk, you do it at least every year. Now, who is average risk? Average risk is everybody. High risk are those who have relatives who have developed the disease at ages below 40 years, in which case you are supposed to start checking yourself at least 10 years earlier. You understand? So you have cousin, a sister who's developed the disease at the age of 40 years, you should start checking yourself much earlier. But there are some people who also have a genetic constitution that makes them prone to developing the disease. Unfortunately, we don't have the capacity to be able to identify them very clearly. So that is a big problem. Who knows Kali Minogue? The guy who married Mr. and Mrs. Smith, what's her name? They are Ashkenazi Jews. The Ashkenazi Jews have a tendency to have the BRCA gene. So what she did was to do a bilateral mastectomy and then do a breast reconstruction. So she's taking away the thing that is likely to cause a problem. Okay, next please. If I'm not careful, I'll get into trouble. So what are the risk factors? Anytime you see a doctor, the first thing they do is talk to you and say, what is happening? When did you see it? Then they go into the mode of trying to find, assess the risk of whatever you are bringing, whether it is high risk, moderate risk, or low risk. The first risk factor is gender. If you are a female, you are more likely to have the disease compared to a male. Okay, so that's a risk that we already know. Age, the older, the more likely. Because the disease is a disease of longevity, really. The longer you stay, the greater the chance of getting a genetic mutation in one of those cells. That's basically what it is. Race. Caucasians are at higher risk than we are. However, we get the more aggressive diseases. Okay? That is what makes it bad in our parts. And then we screen. And then we have so many things that makes it difficult for the person to come forward because of the stigmatization. Okay? Menarche, if you start your menses early, that doesn't mean you are at risk. If you start early and end late, then you have a long period during which your breast gets stimulated, isn't it? I always teach the medical students, don't say that because the person started early, she's at risk. You are not understanding the thing. The essence of early menarche is to talk about how long. It's a temporal issue. How long would the person be going through the cycles that are supposed to be natural and yet dangerous to the breast. Then nulliparity. Someone, if you haven't given birth, it is associated with a higher risk. But I haven't seen a lot of nuns coming to me, honestly. I haven't been operated one, ever since I came here. But it is known to be one of the things. And then those who give birth late. Yeah. These days you go to school and finish, especially when you come to the medical school. I've got a lot of you guys, these girls in my class, my school. And then when I'm teaching breast cancer and I get to that part, they all start laughing because we are going to have to wait until. But in UCC, we don't mind. We'll let you give birth and come and write your exam and pass. It doesn't matter. We don't have a problem with you getting married and being in a medical school. So don't worry about that. So, if you're giving birth late after the age of 30, the reason being that at that time, the chances of you having problems with mutations and cell dysregulation and problems with tumor regulation is much higher. And then that is when you are loading your breast. Pregnancy in itself is a danger to your breast. Okay, you must understand me clearly. Don't go and say, what I'm saying is that when you are pregnant, you produce so much hormones that the breast is under a barrage of these hormones, and it increases the chances of it happening. But if you do it at an earlier age and you get pregnant at an earlier age, the dangers are less than when you get pregnant at an older age. Let's go on. The use of contraception. There hasn't been any study that says that contraception has actually increased breast cancer per se to the extent that it is not used. However, we do know that when you are using contraception, you use supranormal doses, and therefore you are overstimulating the lobules and the ducts. The cells get into trouble a lot more because of the cycle that you go through. And that is also true for those who get to menopause and they want to be posh. He's having hot flashes. Just take your hot flash, because you go and take the patch, and that is when you do not want to be disturbing your breast with those hormones. And now you are taking a patch. You exchange your comfort, your life with just the comfort, because the chances that you get a cancer is much, much higher. Smoking is no good. This fat intake. I don't like it when the student asks a patient in an exam, do you eat fat? And I say, what? Don't you eat fat? Everyone eats fat. What the question is that? What they are trying to say is that if you are obese, then you produce a lot more estrogen peripherally. Okay? Then there are some that I would go over. Go next slide, please. So there are a lot of these risk factors. This slide is just talking about specific genetic mutations, genetic constitutions that people have. Germline mutations like BRCA1, BRCA2, these are specific. If you have them, within the period of, by the time you get to 80 years, you definitely develop it. And therefore, people who have this kind of disease, they tend to want to do a prophylactic mastectomy. Okay, so there are certain genetic diseases, genetically associated diseases, that also increases the risk. Now, when the doctor finishes, then they put that together and say, if you have a lump and you have a family history, I didn't mention family history. Yes, family history is very important, especially first degree family history. That is people that you are directly, your mother, your aunt, and things like that. But remember that the family's history it relates to both your mother's side and your father's side. We tend to forget the father's side. Maybe the father's side is the problem. So you say, does your mother have this? Does your aunt have this? And you totally forget that your father's sisters and things like that are equally important. Okay, go on. How do we diagnose the disease? We diagnose the disease by doing three things. A patient comes to you, you take the full history as I talked about, and to take the risk profiling, and then decide that this person is at high risk, moderate risk, or average or low risk of having the disease, which includes the age of the person, whether the person had a child, whether the person ever had a surgery done on them, whether they had a history of some other kinds of cancers. They may be related. All those things we take during the encounter. And you should learn to give history and not come and give the doctor your opinion about your disease. It's a different thing talking about, I have this problem, and then also telling the person that, I think because of this is why I have this. I simply don't like that thing. Because when they do that, then he's selling a diagnosis to you. We must learn to say what exactly we feel. I felt a lump in my breast. I felt it about 3 months ago. I was bathing when I felt it. It's not painful, but it's just there. It's beginning to grow bigger. I'm worried. That is much better than saying I've seen something last year, I fell down, and because of that, I think because of that, I have this. That is not a way to give your history. After the history taken, we examine the breast. An examination of the breast in the clinic is called clinical breast examination. It's actually one of the things that we use for screening. Self-breast examination is the one you do at home. You do not examine yourself during your period. You examine yourself after your period. Okay, because during your period, because of the high levels of estrogen, the breast is sensitive, is tender, and then also the blood supply is so high that it may look nodular, and you may have make a mistake. So you wait about a week after your period before you do your examination. Do not do it too frequently, otherwise you wouldn't know what is happening. So every day you are like this. The problem will be there, and then you wouldn't know it is there. You want there to be time between when you did the examination, so that if there are differences, you are able to pick them up. Okay? So you stand in front of the mirror, hands on your shoulder, lift them up. If there is any asymmetry, you should report it. Okay? So for the doctor, that's the same thing we do. Raise your hand up, and we look at your nipple to see whether it's retracted. We look at the skin to see whether there's a change in it. Then we examine. If there's a mass there, I can tell this is a malignant mass or that is a benign mass. But it is not for you to say. You come and let the qualified person say so. After we've done the examination and then the history taken and examination, we then go to the next step. If you are young, you go for an ultrasound of the breast, because the breast is dense in the young person. So if we do an X-ray of it, which is actually what mammography is. If you use mammography in a girl, in a lady less than 40 years to 35 years, it looks all white. You miss out on the problems. So you use an ultrasound. The older ones do mammography. Indeed, in most cases, they use both in order to enhance the better outcome in terms of getting the right diagnosis. Sometimes we use MRI, but when we use MRI, there are specific reasons for it. It is not for this particular discussion. But if you use MRI, you tend to overdiagnose. You make people worry for things that are not necessary. So all you have to do is an ultrasound and a mammogram. And for my sisters that are here, remember, all of you are average. You should assume you are average risk. If you are average risk, you should do your mammography once every 2 years. Don't give your mammographic film to the doctor. You forget where it is, they will lose it. And don't go and put it in a place where water will touch it. And that mammographic film is so important to you. Anytime you are going the next time, it must go along with you, because you have to look at both to see what difference there is. Okay, so that is one thing, an advice I have to give you. Don't give your mammographic report to anybody. Okay. Now, after that, you do a biopsy. So you have to go in and take sample of the tissue and send it for the pathologist to look at it. I decided not to bring the very gruesome ones. I don't know, my brother is wicked. Okay, so if you look at this, you can see that there's asymmetry. Okay, the asymmetry tells you that something is happening somewhere. Okay, the small one may be the trouble. It doesn't have to be the big one. Okay, but you can see that there is a mass in the middle of the left breast. And then when you examine, there are features that you will be able to use to tell that this is a malignancy or not. Then you go and do a biopsy. The biopsy is what confirms it. You never confirm a breast tumor with mammogram. Even though it looks like it and has all the features, you say that, well, it suggests it is. And no one would give you any treatment until they have had tissue diagnosis. This is medical legal issue. Next, please. How big is the problem? I think they've said everything about how big the problem is. In Ghana, what I have to say is that the age of the people that have the disease that come to us in the hospital is very low. Okay, we've seen 25-year-old people with the disease. But the outcome depends on the way they behave. The 25-year-old lady, a girl who came to me with a T3 lesion that looked so advanced, but she stayed there and then had her treatment. I ended up operating and leaving the breast intact. After she had had the chemotherapy, she's very hairy. And I told her, you are going to lose the hair, but it will come back again. On my birthday, she sent me a message. She's fine. She's fine. Okay? But if you get scared and then you ask people to pray for you, God has the right to use anybody. Even iniquitous people like me. He can use me if he feels like that. It's Martin I want to use, not the pastor. This one. That's the one I want to use. But this idea that someone alone has the right, he talks to God every day in the morning, he's the only one who can do something. So it disturbs the message. We have a lot of things that we do. So let's go over it because we've already talked about how bad it is. Go over. Now, the way forward, I think that there is a lot of education. No one can tell me that every year they don't hear about breast cancer. The message is going. The education is taking place. The problem is how confused the message is. The mixture of information, the confusion, the fact that people think that they can beat cancer. Cancer is not something you play around with. The Breast Society of Ghana has actually become the game changers. They have changed everything, and they have oncologic teams, and then because of that, the outcomes have improved. Take it from me. Before I came, most people from Cape Coast, or no Cape Coast person was operated on breast cancer in Cape Coast. Most of the time they were sent to Kolebu. But in the last couple of years, we've done more than 2,000 cases here, and they're doing very well. Because we have an oncologic team, the outcomes are very good. And we are beginning to do more and more breast conserving surgeries than just doing mastectomy. So the fear of loss of breast is not really very, very important these days. And the most serious thing is that the lack of confidence. People don't have any confidence in what we do. A lot of patients, almost all the patients, 85% of patients will come to us with a stage 3 disease, and yet they want to have the same results as someone who comes with a stage 1 disease. If you do a mammogram and they see the disease at the point where the cells are still not broken through, and I go in and excise that thing, that is a cure. But if you come at the point where it is a mass and it is called invasive, then try as you want, you are only palliating. And that is why it is good to keep on doing the screening exercise. The workload is high and all of us must take part. And if you do not understand something, even when you read it and the AI talks to you or Google talks to you, don't take it hook, line, and sinker. Go to the one that has the knowledge and say, this is what it says. Most of the time you are wrong. And say, whoa, that's not what it says. You are misunderstanding the whole thing. You can't just read something. Sometimes you just misconstrue the information, okay? And all of us must take part. You have ants in the house with wound sores in their breasts. And they think that if they come and they have an operation, they're going to die. Most of the time, they are going to die anyway. It's not the operation that caused it. It's already too late. But you can palliate and give a person the dignity to be with the children. How about the fact that they can't even go into public? You know? So you encourage them to understand that a lot of people do very well after the surgery. we don't have a lot of time, so I think I'll stop at this point, and then if there are questions later on, I'll try and answer.
Thank you very much. We can do it better. That's been a very instructive session we've had. Prof. Yamful, I don't know if we have time for questions, do we? Okay, when we are done, I think the opportunity will be given for us to pose some questions. And so, being diagnosed with breast cancer, listening to Prof, is not a death sentence in itself. And we are privileged to have an individual who has survived it and will be sharing her story with us. Before we listen to our survivor, we will be treated to a musical interlude. Musical interlude, please. the moment where we get to listen to the story of a survivor. With a warm round of applause, help me welcome Mrs. Gina Kuma Jaga. Let's do it. Let's applaud her while she comes up. You are not stopping till she gets here.
Good afternoon. Please, I'm waiting for my presentation to be projected. Okay, thank you. So yes, the name has been mentioned. I'm Georgina, and I stand before you this afternoon, not just as a survivor, but as a mother, a wife, a sister, a licensed counselor, and a daughter. My mom is right behind me, behind you there. She came all the way from Accra with me. So my presentation is titled, I Am a Survivor. I need your support and no stigma. I want us to start with this question. If your sister, daughter, mother, or wife had breast cancer, what would you stand by her? That's a question I'm putting to us all. Would you offer love, presence, unwavering support through every difficult moment? Or would you stand back, creating distance, letting fear and misunderstanding replace compassion? Let's take a moment to truly reflect on this question. Because for many survivors like me, the deepest wound doesn't come from the cancer itself. It comes from how people respond. That is where stigma begins. It starts in the silence, the hush, hush, hush. The kafra. Kafra. Before they even say breast, the kafra. The averted eyes. The empty chairs where friends used to sit. My journey from diagnosis to survivor. I was diagnosed at the age of 31. I noticed the lump in 2017, October, but there were some series of misdiagnoses, and I was finally diagnosed in 2018. My world changed in an instant. What followed was a cascade of medical interventions that will reshape not just my body, but my entire life. So when I was diagnosed, I was told it was an early stage cancer, and considering all other factors, I qualified to have my breast conserved. So I was going to have a surgery, but then they were just going to take the lump and then part of the breast. That is a lumpectomy. So, and that gave me hope. So amidst all the chaos, the confusion, the drama, the pain, and all that came with the diagnosis, I felt that, oh, okay, so I have breast cancer. I'll be treated, but I'll still have breast. But that's changed. because after the chemotherapy, I had to go back to the theater again to have the conserved breast removed. So I had chemotherapy. I'm sure most of us have heard about chemotherapy. And yes, that is when we'll get to lose our hair. Most people that I know that have had chemotherapy lost their hair. At Kolebu, we are more than countless number of women for breast cancer alone. But I only know 2 people who didn't lose their hair. I don't know how they prayed. Or but for most of us, we lost our hair. But it does grow back, because that's always the concern of many people, that when they lose their hair, what happens? Will the hair ever grow? It does grow back. So when you see a cancer patient with a bald hair, it's not the cancer itself that causes, it's the chemotherapy. And so I had a mastectomy. As I always say, I lost my breast, but it was a price for my survival. I had radiotherapy. Every day I had to go to Kolebu for this therapy. Some people would do more than 16, but I had 16, so 16 days. And then I'm on hormonal therapy. So you see this therapy thing. When you are diagnosed and you are trying to process the diagnosis, because immediately you are told you are diagnosed, the first thing that comes to mind is death. Am I going to die? My dreams, what happens to them? They don't end there. They tell you, okay, in order for us to help you survive, you may need to have lumpectomy or mastectomy, radiotherapy. You know, that you are even confused them more. You know, and I know people who will be diagnosed and they walk out of the consulting room. They came in with their own car, but they walk away. You feel like the whole world has been placed on your head. It's very terrifying. Next slide. So this was my first surgery, where the breast was conserved. You can see how swollen the breast was. You can see the scar beside it. You can see me down there. You can tell I was in deep pain. Next slide. So this was during chemotherapy. You can see me with the bald hair there. So if the hair is going off, anywhere there is hair, the armpit, if you are lucky, it will spare you your eyebrow and your eyelash. Otherwise, even those, all of them will go off. But you see how I'm looking like a goddess. Somebody says it's not a goddess, a deity. Okay, so this was when I had the mastectomy, where the conserved breast was removed. So the first image is when I was being prepared for theater. The middle is when I came back from theater. And the last one is me today. So you can see that when they take the breast off, they don't leave an open wound for you. It's stitched. It's stitched. So you just see a thin line there. Very flat and smooth. So that is radiotherapy. People wonder how that is also done. So you see that it's a bed, you lie down, then you just see some rays of light targeted just to the affected area. So the marks you see there, they are not from the cancer. They were intentionally marked. So they know, it's during the simulation time. So I think it's part of the process. Next slide. So I'm on a daily pill I'm taking for the next 10 years. I've done a little over 6 years. And it's not easy, because this is a medication that suppresses the estrogen production. So we often exhibit symptoms of menopause, the hot flashes, forgetfulness, and but every day you take it, you are reminding yourself that this is what will help you to take the cancer away. So the hidden wounds, what cancer took beyond my body. Yes, I didn't just lose my breast, I lost friends, interestingly. You think that it's during these hard and difficult times that those, you believe, care about you, will even come closer. But sadly, I always say, my very, very good friend, my own maid of honor, for whatever reason. You call, she will not pick. And even some family members, I believe, quietly waited to hear that I'm dead. Because for many people, once you are diagnosed, there's no chance for survival. At social gatherings, I'm very much aware that when I'm coming, those who know, because I never hid my diagnosis. So those that know you have lost your breast, when you enter, they are not looking at your face, they are looking at your chest. Probably looking for the breast cancer or looking to, I wonder exactly what they look out for. But look at me. Do I look like I've lost a breast? Packaging. So yes, as I say, they just go to my chest looking for cancer. That's what stigma does. It actually makes you invisible, defined not by your courage, but by your scars. So friends will disappear, family grows silent, then social gatherings became more painful. And stigma in the family. For many survivors, because I'm now a patient navigator, so I navigate other people who are diagnosed through the complex medical system. And I've heard a lot of stories. I'll share, in the course of my presentation, I'll share some live stories with you. So many people will complain that they are treated as though cancer were contagious. So they wouldn't want to come close to you. When they are back from the hospital, they dedicate some cap and cutlery to them. They will say nobody should touch those ones. Some will not even come very close to you because they fear once they come close, they will catch it. And I often would receive calls from husbands asking if in the course of sexual intercourse they will get the disease from their wife. So it is real, but it is not contagious. And love turns into silence. The very people who you expect to offer comfort become the source of profound isolation. Children kept at a distance, grandmothers, aunts, and mothers separated from the young ones they adore just because they fear you will give the cancer to them. So this is MF's story. So MFR returned home after surgery, expecting comfort and care. Instead, her mother whispered, "Don't let the children get too close, or they may catch it." The pain of that rejection cut deeper than any surgical incision. It's worse than the scar on her chest. Among friends, before diagnosis, you see that, you have some tight circle, constant calls, laughter, shared memories, and unwavering support. After treatment at important meetings, all you'll be here will be whispering. And then as shared by Amma, she said she returned, she had a very tight circle of friends who knew everything about her life. But after chemotherapy made her hair fall, the invitation stopped. When they are going for gatherings, nobody calls her again. And at her best friend's wedding, this a wedding that she was involved in the planning, she was deeply involved in the planning. At the wedding, she overheard someone say she should not sit at the front because people will stare. She cried, not for cancer, but for shame she didn't deserve. Hurtful whispers follow survivors everywhere. She's no longer complete. You hear that a lot. Some will say, when they meet potential spouses and they open up about the fact that they've lost a breast, we're like, no, I want a complete woman. This hurts a lot. At the workplace, careers are cut short by prejudice. The professional cost of survival. Some survivors often face devastating career consequences that have nothing to do with their ability to work, and everything to do with others discomfort and ignorance. Yeah, because for most people it's not about you, having lost your breast, but it's about the fact that they can't just process the fact that you've gone through all this. It makes them uncomfortable. Many times when I tell people around me I've gone through it, I've lost my breast, they get home and they'll call me that, Gina, suddenly I'm feeling pain in my breast. So for that matter, if they can afford it, then they'll rather not have themselves around you. Some are passed over for promotion and opportunities. Some subjected to inappropriate comments about appearance. Some are pressured to resign or take early retirement. Some are viewed as weak or unreliable despite full recovery. So Oguaa shared that though she was a very devoted teacher, loved by her students and respected by her colleagues, she returned to work after surgery, eager to resume her calling of teaching. Her headmaster called her into his office and said, "Parents may not be comfortable seeing you like this. Maybe you should stay at home permanently." So Oguaa didn't lose her job to cancer. She lost it to stigma. Stigma in places of worship. When faith, community fail. I had my fair share. Somebody asked if I might have had a breast cancer, probably because I wasn't paying my tithes regularly. Yeah. So I was wondering, the lady reverend that I know that had breast cancer, so this is a reverend herself that had breast cancer, then what could be the problem? Illness is often seen, the illness is seen as spiritual punishment. There are some people who are told that they had it probably because they cheated on their husbands, or maybe they were after somebody's husband and they were cursed. Some, they say maybe your parent did something and you had to pay for it with your breast. So instead of recognizing cancer as a medical condition, some faith leaders frame it as a divine judgment or the result of hidden sin. This theological cruelty compounds physical suffering with spiritual trauma. The very spaces meant to offer refuge and comfort become sources of condemnation. Survivors are told to confess sins they haven't committed or to accept blame for circumstances beyond their control. So Miriam shared this, that she went to church seeking prayer and spiritual comfort during her darkest hour. Instead of finding the embrace of her faith community, a church leader told her, "This sickness is because of hidden sin. Confess and God will heal you." Miriam left not healed, but condemned, wondering if God himself had abandoned her. The spiritual wound inflicted that day took longer to heal than any physical scar. Stigma in the marketplaces. People refuse to buy from you once they know you have the breast cancer. It is real. It is so real. Because I navigated a tomato seller. The moment she recognized me at the hospital, I was looking at her, she was looking at me. Then she's like, "I think I know it's someone." He said, "Shh." So when I'm like, Medina Market, say, "Ba me pacho, Emma Obianti." I used to buy from her, but anytime I come to market and I'm coming close to her, I feel she feels uncomfortable, because for me, everyone knows I'm a breast cancer survivor. So she feels that maybe if I come close to her and we are chatting, people may call, I don't know, but I realize she's not even comfortable with me coming close to her. And there's a story I'll share from it. Please, the next slide. At the hospital, it will amaze you that even at the hospital, we are stigmatized. Ajua complained of unusual pain after radiotherapy, seeking help from those trained to provide it. A nurse signed heavily and said, "You cancer women always complain too much." It is real. I've heard that myself before. She left in tears, broken not by the pain, but by the dismissal. I mean, there are things that we face. I just want to share some. Legitimate concerns are usually dismissed as you are overreacting. Because believe you me, there are times that you are feeling things that you can't even explain. I know pink sisters who would tell me that when they were on chemo, they felt like their souls were leaving their body. How do you explain this for somebody to understand? And I remember when the conserved breast was discharging blood. Strangely, when I go to the hospital, they'll squeeze the breast, they'll press, they'll do everything. The blood will not come. But the moment I'm on my way, you see that I'm stained. It is some of these reasons that people will say it is spiritual, but I know it wasn't spiritual. And so anytime I come, you're like, no, there's nothing there. Maybe I'm overthinking, you know. So at the end, I had to take video of when the discharge is coming before they believe that, yes, truly, I'm having a discharge. And there are times that our pain are minimized or attributed to anxiety. Healthcare workers showing impatience or annoyance. Sometimes it's the pressure, the burden that is on them. So some of us sometimes empathize with them. Doc, sometimes we do. And feeling like a burden rather than a patient deserving care. What do we need from our health system? Validation of our experiences and concerns. Thorough investigation of new or unusual symptoms. Many people have had to pay for doctors' negligence just because their concerns were not taken seriously. Oh, it's part of the chemo side effect. Meanwhile, I mean, whatever she was complaining about doesn't have anything to do with chemo effect. Compassionate, patient-centered communication. We need it. Sometimes you see that a daughter, has your folder. She's just asking you questions, not even looking up to see your face, just jotting down things. Okay, okay. Go and continue with the radiation. But when we have issues, we can't even say it because it's like you don't even have time. It's like you are angry. It's like you are burdened. It's like we don't exist. We are just there as sort, patient. But it will interest you that when we meet the same doctor in a private facility, it's different. The attitude usually is different. I understand when we meet them at the public hospital, they see us as a patient, but at their private clinics, we are clients. So they treat us more special. I think they should also recognize that we know our bodies best, so that when we complain, our complaint should be taken seriously. The next slide. So this is Cynthia. Cynthia is 40 years. She emerged victorious from her battle with breast cancer just 3 months ago. Determined to rebuild her life, she invested in a fufu pounding machine through the support of a philanthropist. But her newfound hope was short-lived. Mind you, Cynthia is a single mother of 5 children. Her husband left her when she was diagnosed. Customers shun her, opting for vendors farther away. Usually, they whisper among themselves about her condition because she was very open about it. The silence had been deafening. A constant reminder that she was no longer desirable. Cynthia's eyes wells with tears as she wonders, have I become untouchable? Am I no longer worthy of love and acceptance? She holds on to hope that one day her community will see beyond her illness and recognize her resilience and bravery. I witnessed Cynthia's journey. I want to share a part with you. So she stays at, okay, so let's continue. Okay. So this is the lady at the back there, the one with the glass, she's Elsie. So, just to emphasize on the power of support. Elsie is a nurse. When she was diagnosed, you would expect that as a nurse, she would have it easy. But, once you are a human being, regardless, you are diagnosed with something that is life-threatening, you feel it. But with the support of a colleague, she was able to sail through. Next slide, please. The emotional toll of stigma. We are often left with depression, anxiety, isolation, loss of dignity, and fear of recurrence. Stigma kills twice, once in the body and again in the soul. Next slide, please. Ladies and gentlemen, this is my body. What you see there is my scar. Some people see it as a reminder of loss, but I see it as a reminder of life. Every cut, every stitch, every tear I shed, every sleepless night was proof that I chose to live. And today I stand here. I stand before you, not broken, but whole. So I implore you not to look at my scar with pity. Look at it with respect. Because behind every scar like this is a survivor who needs your love, your support, your understanding, not your silence, not your whispers, not your stigma. I am a survivor, and with your support, many more will survive too. Thank you very much.
Another round of applause for her for sharing her story. I see Professor Drew here, and I can't help but ask this question. Why is it that, when it comes to marriage, and then a spouse is confronted with such a condition, it always happens that the men predominantly will chicken out and leave you? Because if you've all followed, there was a lady who has suffered throat cancer. She's on social media. She's an activist now. She's actually my mate from Infantiman Girls. And she has a sort of something here to help her speak. That's a big one for the medical people to pronounce. Right, so she speaks and she has to press on this thing for you to hear her speak. And sadly, when her condition started, guess what? Her husband abandoned her when she most needed him and the support that he could give. So I'm just wondering, what is it that makes, forgive me, the men to run? That will be a question to be answered by the gods. I'm sure nobody would want to answer that now. But it's an unfortunate situation that we find ourselves in. So on the program outline, we also have a book launch. And to do us the honors is Professor Georgina Ya Odru, the head of the Department of Sociology and Anthropology here at the University of Cape Coast. In fact, she's a former director for the Center for Gender Research, Advocacy and Documentation, UCC. That's why I was asking her why the men run.
Thank you very much, Akosia. And Gina, my name. Congratulations. I really was looking forward to getting here and give you that huge hug, but you left the podium before I could get here. We are namesake, okay? And we are going to be friends. I'm going to take your contacts from here. Congratulations. God bless you for the work you are doing. Professor Chair, colleague, lecturers, and senior members, our invited guests, ladies and gentlemen, our young students, we are really happy that you are here because this is about you and it is about our future as humanity. And the fact that we have men but also women with us this morning, or boys and girls, because breast cancer, it relates to all of us. It's not just about women. The fact that you came into the world with breasts, with cervix, and with prostate, so you are prone to it. Have a very good afternoon. So I'm standing here representing the director of SEGRAD, my colleague, Professor Eunice Emisa, who was to have done this or performed this role. But it's not surprising because I was also the former director for SEGRAD. So my greetings to her when you go back. Tell her that I performed her role for her dutifully. I wish to congratulate the Breast Society of Ghana, the organizers, especially Professor Akwesi Enyamfo and Professor Mona, my neighbor, for this kind of work. We've been witnessing it annually, and they've been very, very good in sustaining it. And the fact that they are men, of course, you were asking, why do we have the men abandoning them? But look at these men. They've been with us throughout, so it's about some men and not all men. Let's clap for them. And we've all been touched this afternoon. We've all been touched this afternoon. We've all been touched this afternoon. So we thank the Breast Society of Ghana for coming out with a book that tries to demystify, because listening to the stories, it is obvious that ignorance, myths, miscommunication, misinformation, a lot of things that we don't know is what is fueling what we are experiencing. And as we heard, it isn't even about the disease, but it is about the reaction. We hope and pray that through this book launch this afternoon, we will learn, unlearn, and relearn, and change our attitude towards survivors, if any. Actually, talking about breasts, I did a paper which was about cleavage and breast exposure among young people. And when we're talking about cleavage, you know the space between the breasts. And those days, women would dress and push some of us, we don't have that much, so we can't push it. They will push it and then oil it, and then they will say masheja and those kind of things. Those of you who heard about that. So that was what informed me to undertake this study among young women. And in my research, I came across a saying which I like a lot. It says that the breast connotes different things to different people. In that, babies see food when they see the breast. Men see sex sometimes, or erotics when they see the breast. Business people see the opportunity to make money when they see the breast. And medics see disease sometimes when they see the breast. So, depending on your standpoint or your perspective, we see the breast differently. Another author said, Gabriel Palmer, he says, the breast is a life giver, but also a life destroyer. And this afternoon, we are looking at the life destruction aspect of the breast, unfortunately. So this very important organ that God has given to us, that nurtures people and brings up the next generation, also sometimes put us in that awkward position of giving us diseases. And all the reaction that we had this afternoon, we tend to encounter. So we thank the Breast Society for this book. I'm not going to bore you much about the Breast Society because during Professor Ayamfo's presentation, he mentioned a bit about what they do. But they are here to help us. Accordingly, it was an NGO established in 2018 with over 200 registered members. And they are here to educate the public, to help manage diseases, what we are doing here. So that's about the Breast Society. And the empowerment program, of which we also heard a lot from Professor Mona, which was tasked to produce a simple to read. So the empowerment program actually tasked some people to work on this book that we are going to launch this afternoon. And they were tasked to produce a simple to read and understand manual that should be available and accessible to everyone seeking information about breast cancer in Ghana. So this book is not that technical, not the very scientific concept we had this afternoon. When my friend, my colleague was saying, Akosia needed the concept, and she mentioned, and we couldn't mention it, isn't it? But this book is that simple, down to earth language for everyone to listen. So the book starts by introducing you to breast cancer, using simple words and pictures for illustrations. Some of us are lucky to be here this afternoon. We heard a lot through the presentation. Not everyone is here. So having the book, we can share with colleagues who are not here, so they will also learn, and then the misconception, the myths, and all the ignorance will gradually be faded away. So it starts by introducing you to breast cancer using simple words and pictures for illustrations. It continues with signs and symptoms and tops the introduction with statistics and facts about breast cancer in Ghana, but also globally. The book proceeds to explain in simple terms and pictures how breast cancer is diagnosed and staged. The treatment options available in Ghana is discussed, with discussion on chemotherapy, radiotherapy, hormonal therapy, and all the therapies we can think of. The book also discusses them. We also do hear expressions such as the cancer has spread. What does this mean? This is also handled by the book or the authors, so it's discussed in the book. The book explains the whys and the wheres and how the surgical team handles the spreading when they occur. It continues by saying that cancer is not a death sentence, as evidenced by our survivor story, my pretty friend Gina. However, as a survivor, are you really cancer-free? That's the question. Like the what next after the treatment? Do you need special diets? Can you become pregnant again? And those burning questions, they are addressed by the book. Then there is a psychological aspect. We do know. Literature has established that most of the time when we don't know, we are afraid, and that mystery, that mystique, really fuels the disease rather than the disease itself. So the psychological aspect is also handled in the book. How family and friends, the support systems that should be available to people when they are affected and they're infected. The labeling, the stigmatizing, all these are handled by the book. Last but not the least, the myths. Breast cancer is a case. In her story, the fact that the church or the religious space, where when all others turn against us, we need to go for solace. That is the very space where we are shown and where we are discriminated and when we are pointed fingers at and where we are stigmatized. So the book also talks about the religious aspect. Is it a curse? Is it from my ancestors? Is it being bewitched? Was I promiscuous? The victimization, the causation. All the challenges that we seem to grapple with this book try to debunk and try to answer through scientific means. I am not telling you everything. I want you to desire to own the book, to have one and to read it. We don't want a situation where you may have it and put it by your bedside. We want you to read from page to page. There is a lot you will learn about breast cancer from reading the book. Without much ado, and on behalf of everyone here, I want to formally launch the book, Breast Cancer, diagnosis, treatment, facts, and myths. Can we clap whilst we... Okay. Okay.
They come to show us how to
Okay.
do their fireworks.
Should I hand it over to you now?
No, so you, the last sentence is here.
Yeah, that's fine. I'll read it.
So, oh, remove it.
So, would you take it off first?
Yes. Okay, so your last sentence again.
So, on behalf of the Breast Society of Ghana and on behalf of everyone gathered here this afternoon, we want to launch this book in the name of God the Father and also of the Son and also of the Holy Spirit. We duly launch this book today. Hooray!
Right. Let's hear it again. So the book is duly launched, and the Breast Society of Ghana is kind enough to donate some of the books to all of us here, I believe. I'm going to start. Do we have a rep from the Central Regional House of Chiefs? If not, Margins ID Group. Do we have a rep here? Margins ID Group. Do we have a rep here? Zenith Bank? All right. I'll call on Mrs. Obingansong to help us. Segrad. Professor Drew, please help us with the first set. Let's welcome Segrad as it takes a copy. Segrad will be followed by Cape Coast Teaching Hospital. So representative of CCTH. Do we have a rep of Doctors in Service here? Ankerful Hospital, do we have a rep from Ankerful? Oak Tree Medical Center, Professor Mona. We'll pick one. Campus Broadcasting Services, is Anne here? Is Anne here? Please pick it for Campus Broadcasting Services. Directorate of Public Affairs, Reverend Emmanuel Kobna, help us with it. UCC Hospital, Mr. Tamak will pick it on behalf of UCC Hospital. So this is CBS, Campus Broadcasting Services, picking copies. To be followed by a rep Public Affairs to pick copies. UCC Hospital will be next. Mr. Tamak is taking it on behalf of the UCC Hospital. Sam Jonah Library, do we have a rep? UCC School of Medical Sciences, do we have a rep? So the Department of Sociology, I believe Professor Dro will pick it herself. So Professor Kombe will present it to her. UTAG Gawa, SSA Grasag. If we have reps, please come forward. Rep from the prison service, if there's anyone here. Prison service. If not, the police service, the fire service, immigration, please. Can we get a rep from immigration? Children's Station Development Center, if we have a rep here. University Practice Senior High School representative, kindly pick copies for the school. To be followed by Cape Coast Technical. Cape Coast Technical. Academy of Christ the King. Academy of Christ the King. Here. Efutu Senior High. If we have a rep here. Ankafo Psychiatric Nursing. Do we have a rep here? Rep from Infanta Pim School. Infanta Pim School. Do we have a disco here? No. Do we have Wesley Girls here? No. Holy Child School. Holy Child, please, a representative from Holy Child. To be followed by Oguaa Senior High School. Rep for Oguaa Senior High School. Ghana National College. Do we have a rep? Ghana National College. Kwejir Agri Senior High. Kwejir Agri Senior High. Agri Memorial will follow next. Agri. I see nurses and midwifery. Do we have any rep here to pick it? Okay. Ednaman Senior High School. Ednaman Senior High School. Thank you very much. Let's applaud Professor Kombe and Professor Odro. Thank you so much. Let's applaud them. All right, let's applaud this again. The book is launched and duly distributed. Right. So we are gradually inching to the end of the event. And at this point, I'll call on Matthias. He is going to give us yet another beautiful rendition on his saxophone. Let's welcome Matthias with a round of applause. Thank you very much, Matthias. We'll take a message from the sponsor of this Durbar we are witnessing, and that is Margins ID Group. Let's welcome the representative with a round of applause. Let's do it better for Margins ID Group.
Good evening, everyone. It's a pleasure to stand here to be amongst great people, survivors of breast cancer, doctors, and knowledgeable people here. My name is Claudia Boatsma Edise, and I'm the brand manager for Margins ID Group. We've learned a lot today. Personally, I've taken a lot of lessons from today's conversations. And I just want to draw your mind back to a popular social media trend. It was a debate competition, and the young lady said, "Remember the human." Does anybody remember the human? Okay. And it just draws me back to the humanity bit of breast cancer awareness. And just like Mrs. Gina said, the breast cancer is not a stigma. They are human beings who had gone through this process. Some survived, unfortunately, some didn't. And so being a victim or being a breast cancer survivor does not change the identity of who you are. And identity is really something that Margins ID Group is very passionate about. That if whether you're a female breast cancer survivor or a male breast cancer survivor, it doesn't make you more or less a human being than you originally are. So ladies and gentlemen, we would like to spread this message across that in support with the Breast Cancer Society, the Breast Society of Ghana, we want to stop the stigmatization and come together to support the people who are going through this process. I have personally known a few people who are at the moment battling the breast cancer situation, and it's not easy. It's really, really not easy. And even back at the office at Margins ID Group, we are making this month a really important month to conscientize ourselves and promote awareness that you should get yourself checked. A lot of the time, we think, oh, it's only the women, it's only the girls, but the men too. Gentlemen, you are also very important to us, so also examine yourself. Remember, even if it's just once a year in October that you want to bring yourself back to the conscious of breast cancer awareness, go and get yourself checked. I don't know if throughout the program they'll be doing, okay, they just confirmed that, oh, okay, I just came in today. Yeah, they just confirmed that examination has been going on since Monday. So if you haven't participated, we really want to encourage you to go and get yourself examined. I want to thank the organizers of this program for giving us the opportunity to participate and contribute our quota to the society and bring awareness to this campaign. Thank you very much.
Thank you very much, sponsor Margins ID Group. Ladies and gentlemen, I have the singular honor of asking you to help me acknowledge those of us who have graced the occasion today. And I'm going to begin with our chair, Professor Rufella Kumbe. She is the provost of the College of Agriculture and Natural Sciences here at the University of Cape Coast. Unfortunately, I've noticed Professor Mona has just exited, but then he is the one who gave us that lecture on breast cancer and what it is. We also have Professor Georgina Ya Odro. Professor Odro is the head of the Department of Sociology here at UCC and a former director for the Center for Gender Research, Advocacy, and Documentation. We also have here Madame Paulina Adumako from the Cape Coast Teaching Hospital. Thank you for being here. we have a representative of the director of the University Health Services, Mr. Tamak. We also have from the Center for Gender Research, Advocacy and Documentation, Mrs. Linda Obinganson and Janet Amoa. Let's acknowledge the two of you. Of course, Professor Kwesi Ayamfo. Give us a wave, Prof. Yes, he's right there behind us. He has seen to all of this being put together. Let me quickly also acknowledge our sponsors. Our sponsor, I beg your pardon, Margins ID Group. Thank you for this. We also acknowledge Campus Broadcasting Services, the Directorate of Public Affairs, UCC. We acknowledge the Immigration Service. Kindly give us a wave so that we acknowledge you. Thank you so much for being a part of this event. We also acknowledge University Practice Senior High School. Give us a wave. Right, thank you for coming. Cape Coast Technical, are you here? Academy of Christ the King. We acknowledge Efutu Senior High. If you're here, give us a wave. Infantipim School, the school, give us a wave. You should be applauding. When they wave, please applaud them. We have Holy Child School here. Holy Child ladies, give us a wave. Thank you for coming. Oguaa Senior High, if you're here, give us a wave and we'll acknowledge you. Thank you for being a part of this event. We duly acknowledge Kwejir Agri Senior High. Give us a wave and let's acknowledge you. Thank you. Agri Memorial, give us a wave. Thank you for being a part of the event. And then Cape Coast Nurses and Midwifery, you are here. Give us a wave. Thank you so much. Edna Mann Senior High School, you are here too. Kindly give us a wave and we'll acknowledge you. So we're grateful to each and every one of you. Forgive me, probably I might have skipped your group, but that doesn't mean that we do not in any way appreciate your presence. We are grateful for you being here with us. On that note, I would invite our chair to give us her closing remarks. Let's welcome Professor Rofella Kombe.
Thank you, Akosia. I think we deserve a round of applause. Colleague professors, my teaching faculty, the LOC, my big brother, Prof. Ayamfo, was always on me to make sure that I'm here because Friday evenings I'm somewhere else, within the country somewhere, but I am so happy that I spent my time with you this afternoon. We all can attest to the fact that we have been highly educated by the presentations and the testimonies we had here this afternoon, and now we are in the evenings, early hours of the evening. We have taken a lot from the empowerment project to the survivor's story to the presentation of understanding the breast cancer issues, to all the things that we had. We would have loved to give opportunity for questions, but today is Friday and it's evening of a Friday, so we will have to bring the curtain down. But please feel free to contact all of us on this campus and beyond, and we would give you further explanation. The university hospital is still screening. Likewise, if you contact the medical school, they could also be able to assist you. But to my young ladies, and then my young gentlemen, please, take good care of your body. Take very good care of your body. That is the only one you will own for life. So when you take care of it, be your own specimen. Do the examinations. Feed it well. Not in quantities, but in terms of quality. Be careful of the environment in which you are exposing yourselves. It is good to be alive, but let those around you also enjoy your capacity as a human being. As we conclude this particular Grand Durbar, we are reminding each other that we have to be human when it comes to the survivors. When it comes to those going through the different treatments, our love and support can make a lot of difference. Our love and support can strengthen them to fight the condition. And I know. I want to applaud Mrs. Georgina's mother. I am sure she was the caregiver. You have no idea the pain you go through watching your loved one waste away. I was sharing that each session I saw the hematology lab. You will see them receiving 8 injections. They are different drugs, different volumes. Seeing your loved one sit there and receive that alone is heartbreaking. So, madam, thank you very much for the support over the years. God richly bless you. On that note, thank you very much, and that God bless all of us.
Thank you very much. We'll take the vote of thanks, and that would be done by Miss Esther Aqua Benson. Is Esther here? Let's welcome Esther with a round of applause. After the vote of thanks, we're going to have a group photo on the stage. Our guest will be seated, and the rest of us will be received on the stage to take the photo. However, note that out of this auditorium, there's a backdrop also out there that you can equally take photos if you would love to. Let's welcome Esther once again.
Good evening to you all. I'm so much privileged to be called upon to give the vote of thanks. First of all, we'd want to give thanks to the Almighty God for making this program a success and a very educative one. We would also want to give another thanks to the organizers of this program. Even the first moment they thought about us as women and even as men about this particular month, that awareness should be created, dedication to be given to the young ones to know that this month is specifically for breast cancer, and with that we should detect early for protection. Without forgetting our guest speakers who left their precious time to come here and give us the education and let us know the need for us to also screen. We'd also want to remember our survivors who had the courage, the boldness to come and tell us their stories. That would be a story of impact, but not of fear. We wouldn't want to forget our main chairman, our distinguished guests, and then our fellow students. I love the fact that when we called upon the students, they realized that this is not something they are going to be assessed on, but it's something that will create an impact in their life, and then they were able to join this program. Before this program was also a success, we had individuals who were willing to volunteer to also make this program a success. We believe that all the time spent, all the resources spent for these programs, may the good Lord replenish all and then fulfill all your heart desires for you. Thank you so much.
Thank you very much for thanking us. We'll take the closing prayer, and with this we'll all be on our feet, and we'll call Mrs. Janet Amwa. She's with Segrat to do us the honors.
A minute silence to pray to our Maker. Our Lord and Heavenly Father, we are grateful to you for the opportunity of a day to have an experience. Your word said, lack of knowledge, your people perish. We are privileged that you've revealed this knowledge to us through different means that you have presented to us. We pray that you give us the understanding, the love, whatever resources that we need, so that we'll be able to help each and every one of us, those who will go through, those who have to be a caregiver, those who have to be responsible, the medics, everybody who has to play part in every aspect of this disease. We pray that, Lord, may you graciously grant them the resources that they need, so that at the end, blessings and honor will be given back to you. We thank you for the day as we are getting ready to leave this destination. We pray that you order us as you brought us safely to our various destinations, and help us each day as we reflect on our daily life, oh Lord. We pray that if it is your will, take this disease out of us and grant us the peaceful mindset so that as we go through our life journey on this world, we will have the peace of mind and love. Continue to shower your blessings upon us today, tomorrow, and forever. This we ask through Christ our Lord. Amen.
Amen. Thank you very much, Janet. So that's it. This is the end of the empowerment project, the Grand Durbar. We're going to take a photo. So